Do not have sex. Because one of my patients, he had sex on the same day. He told me it was good because his penis was swelled and it got even bigger. Is because if I remove them all, they will not have any sense in it.
Feel numb.
Then it's no longer their penis, it's someone else's penis.
Hello everyone, I'm Dr. Koo from Taiwan. Today we're at IIEF Urology. We're going to interview Dr.Koo.
Hello, I'm Dr.Koo from IIEF Urology.
Today we're going to ask some questions about the penis enlargement surgery, aka 5S surgery. I got some questions for Dr.Koo. In Taiwan, there's a lot of people is discussing about penis enlargement surgery, and all the patients worry about the safety. What's your opinion?
If the surgery is safe or not, because it's a very important part. I've been doing this surgery for over 15 years, at least 10,000. I don't really count my surgery. Usually the complication comes from the person with uncontrolled diabetes or someone with implanted illegal substance like Vaseline, coconut oil, plastic, general bees, sometimes even gold. But for the first case, fresh case, or a person who has been treated before in a clinic, legally way, they rarely have any problems. So when I tell my patient, they always ask me, is it safe? And I will tell them, it's really safe as long as you obey the few things that I require them to follow.
In my clinic, when I do after the surgery, I always mention about how important it is in post-operative care. And I would ask the patient to come back to our clinic for 7 days. And they come back, we will change the dressing for them to reduce the infection rate. And what kind of requirement would you ask for the patient?
Do not have sex.
Do not have sex.
Do not have sex. Because one of my patients, he had sex on the same day. He told me it was good because his penis was swelled and it got even bigger. And second thing will be no alcohol. Sometimes they have fun, they have alcohol.
What about smoking?
Told them not to smoke, but nobody follows.
Nobody follows?
Yes, they just go smoking right after the surgery. Their nicotine blood level dropped dramatically after the surgery. It should be prohibited, but not many people follow that.
After the operation, they come back on day 1, right? So you see the wound and they tell them how to dress.
They don't come back actually.
They don't come back?
We have a YouTube channel teaching them how to do the dressing.
That's clever.
If they need the stitch removal, they will come back around 2 weeks later for the stitch removal. Or if they still cannot come back for stitch removal, we write them a referral note so they can remove the stitches nearby their house. And for people who does not have stitches, they usually don't come back after the surgery. So we just communicate them with Line or Instagram. We just share the photo and tell them what to do. And usually it follows up quite well.
Same in our clinic because we're connecting them with Line and then tell them what to do after the surgery. But I will remove the suture about 3 weeks or 4 weeks later. I will take longer for better wound healing.
Yes.
Yeah. Next, I want to talk about the proximal gap. Patient is complaining about this. If the graft is too small, then there was a gap between the penis root.
In my case, I will tell them we cannot eliminate the gap, but we can minimize the gap. Because when the patient is not having an erection, there will be almost no gap.
Yes.
But when the patient is having an erection, as the calf get harder, the graft will elevate and the margin will be more visible. But I tell them as time goes, those margins will slightly fade, but will not disappear, but fade, make it less prominent. But since we have augmentation, we can minimize the gap, but we cannot eliminate the gap.
Same for me, because when I first doing the surgery, I choose a smaller gap, a smaller graft, and there's a big gap. After that, I choose bigger graft for the patient. But if I put it's too big and it will just bend, but no gap. Sometimes I will inject some megaphill at the penis root. I heard some doctor would inject fat at the proximal gap. What's your opinion about this?
To eliminate the gap, there's few ways. Implanting a larger graft so they can cover the gap is the most expensive way, but it's also the most natural looking way. If you go with cheaper method, we can go with the megaphill or we can go with fat. But if you inject too much fat, it will look like a Michelin tire.
Some doctors said that injecting fat at the penis, the touch is soft, right?
Yes, if you inject the right amount of fat, then it's good. But usually when they come, they ask you for lots and lots of fat. So if you inject the right amount of fat, I think it's good. I always tell my patient not to be too selfish. If you become too selfish, the penis shape will just go out of hand. It will look very weird.
It's not reversible, right?
You have to do a surgery to remove the fat.
Yeah.
So another surgery is required. Another option will be HA filler.
HA filler.
HA filler is simple, less invasive, but also looks less unnatural. And if you inject the fat or any a fat, HA filler, or mega fill too much, they'll migrate to the pubic area. Because as you can see, all those are semi-solid. So when they're having an erection, if you inject too much, they will migrate to a free space. That will be the pubic area.
So the pubic will become swollen, right? Because there's some patient come to my clinic and they say they had HA filler under the foreskin, but it looks like a bump.
Yes, we call it turtle shell.
A turtle shell.
Like the Dragon Ball, when they wear turtle shell on the back.
But turtle shell is hard, right? And the HA filler is soft. Yeah, so it's like a jellyfish.
Yes.
Yeah. So it's kind of weird, unnatural. But I think maybe the doctor inject the too much and the too shallow.
Usually when you inject fat, mega fill or HA filler, I'll make a coordinate and inject little by little on different coordinate to make sure it will minimize the migration. But if not non-experienced doctor, they'll inject everything in the same space.
So you want different area, right?
Yes, different areas, so that they will not communicate with each other.
Make it even.
Yes.
Yes. Talk about the glance. Glance augmentation is sometimes hard.
No, it's always hard. It's because the fingertip, the end organ, always have a high risk of necrosis.
In my opinion, you inject too much filler.
Too much filler or too shallow.
Or the dissection is not enough. If you dissect enough, the pressure would go lower.
Yes.
I saw some patient come to here, they got a hole because they got glans necrosis.
Yes.
My patient, there's no glans necrosis now because I try a lot of dissection.
Yeah.
So I can inject right amount and then looks natural.
Making the glans big is important, but I think for safety always comes first. The way how we treat premature ejaculation surgically is by ligating the dorsal nerve. Those are sensory. They have 4 to 6 or sometimes 8. So I will usually ligate. Therefore, I'll ligate one in the left and one in the left, which will remaining one in the right and one in the left. So I always remain a nerve on each side, at least one nerve on each side.
I remember there's almost 5 branch, right?
5 branch. If there are 5 branches, then I'll remove 3 of them.
Yeah.
Always remain 2.
Just remain one, left one and right one.
Yes,
Yeah.
it's because if I remove them all, they will not have any sensory.
I feel numb.
Then it's no longer their penis, it's someone else's penis. As I told, I'll check the IIEF, make sure they have no ED.
Yeah.
If there's no ED, and I'll warn them, this will be irreversible. Then, if they still agree with that, then I'll do a dorsal neurectomy.
Very good point. Would you check the IIEF and the EHS before the surgery?
Everything for every patient. Check IIEF, PEDT for every single patient.
And if the patient got erectile dysfunction, how would you suggest?
If it's just a minor erectile dysfunction, then I'll prescribe Viagra or Cialis post-OP for the faster recovery.
If they got moderate or severe ED?
Then I will still recommend to do 5S and I'll do a penile implant later. Actually, there are a few patients because they know that if they do the penile implant, they cannot do penis enlargement anymore.
Treat ED first because if you got bigger penis and you got ED, it's no use in sex. Yeah, it looks bigger, but it's not hard enough to penetrate the vagina. Frenulum, if it's too tight, after you do circumcision or megaderm implantation, it will be too tight and you will feel very uncomfortable. What's your opinion about frenulectomy?
Same. Frenulectomy directly does not desensitize the penis, but if it releases because of tight frenulum, it is the journal, they say they will improve premature ejaculation.
Yeah.
If I see if you have tight frenulum and you have premature ejaculation, then I'll recommend them to remove the frenulum.
In Taiwan, there's only like 30 to 40% men got circumcision. Maybe before circumcision, your frenulum is not tight, but after circumcision, it might get too tight. For the record, frenulum is the tiny tissue between the glans and the foreskin. It will connect between the glans and the foreskin, and sometimes you will get too tight. There's some doctors would suggest that they would do HA filler or megafill filler only by a small wound. They will not do megaderm implantation. It's like a small wound and recovery fast. Have you done that? And what's your opinion about that?
I prefer megaderm than to filler or megafill is because HA filler and megafill have a relatively high absorption rate. HA filler have absorption rate pending you have around 50%. HA filler maybe over 50%. When you have very high absorption rate, the problem is that you cannot predict the outcome. You don't know where the 50% will be absorbed. Sometimes 100% will be absorbed. Really depends. on some patient. If you use Megaderm or the graft, absorption rate is very uniform. There will be only 30% absorption rate within 2 years. You can predict the outcome and you can tell the patient how the post-OP penis will look like. That's why the patient can get a guarantee how much they will get enlarged, and they will guarantee how the penis will look like. But Megafill and HA filler, you can't, because when you're injecting Megafill or fat or HA filler, you're anchoring those onto the skin on the dartos fascia, which is a loose connective tissue, and it moves around.
Yeah, they will move around. Okay, that's a good point. Because some patients, they might be doing they're maybe workers. They need to lift something or they need to walk around, so they need a fast recovery time.
They want a fast recovery time and have returned to a normal sex life quickly, and they don't care about the penis shape, then I'll do a Megafill or HA filler. But I will tell them your penis will no longer look natural. If they agree with that, I'll perform HA filler or Megafill.
I think one last question. There's two incisions about the Megaderm implantation, right? One is infrapubic wound will be at the penis root, and the one is circumcision wound. Which one would you prefer, and what's the pros and cons between these two methods?
In my case, if the patient has been circumcised and is a fresh case, I will always recommend them go with the infrapubic. They don't need a second visit, and they can take a shower on the next day.
Me too. Is there any difference between these two methods in terms of aesthetic?
No, I think the result is the same. Good part about infrapubic incision is that they don't have to come back for the stitch removal, and they can take a shower quickly. The bad point about infrapubic incision will be there will be permanent pubic scar. And for circumcision incision, the good point will be there will be no additional scar except for the circumcision, so there will be no scar left. But the bad point is that they have to come back 2 weeks later for the stitch removal. For the modern people, taking a day off is not easy.
After the pubic hair growth, the pubic scar will just disappear, right?
Yes.
Actually, the scar is not the issue.
Yes, scar is not an important issue because the scar is minimal. It's only around 2.5 cm.
Actually, in Taiwan, there's a lot of doctors, they are afraid of infrapubic incision, but I like it.
Yes, because infrapubic incision require more experience because you have to penetrate, you have to go through the superficial dorsal artery. Sometimes, if you make a mistake, you might even injure the deep dorsal, and which will cause lots of bleeding.
One time, I got a patient. He had genital bits just below the coronal sulcus, below the glans. It's a ring shape, and the genital bits is in ring shape. And he wants to keep the genital bits. Would you remove it?
I have a similar case. I would say his first love.
First love.
Gave him the bead for his birthday present. I said he cannot remove the bead. So I just implant the graft just more proximal to the bead.
You insert it just not under, just below.
Just below it.
Yeah, just below it.
Yeah.
What would the shape be like? Is it natural or there's a gap?
It's a gap. As he said, the bead is too important for him.
I got the same patient, but I do it in different ways. After I dissect the genital bits, I found there's a layer between.
Yes, there's a layer.
Yeah, so I just put under the genital bits and I put it back. I got a video for that. It's very clear. After that, at first I worry about the infection because genital bits foreign body. But at last, the patient didn't have any complaint and looks very natural.
Because I have one experience, I put under the beads and there was a skin necrosis, skin erosion, and the bead popped out. So after that, I try to avoid, because only 2 cases, I usually change my surgical method. If there's more than 5% of complication rate, then I'll change.
5%.
Yeah, 5% will be my mark. Less than 5, I would still bear, but if over 5%, I will just change the surgical method.
So would you remove it and do the surgery at the same time?
If they want to remove it, yes, I'll do it at the same time.
So if they don't want to remove it, you just put it just next to the bits.
Next to the bead, but if they want to put underneath the bead, I'll do the underneath the bead, but I warn them if there's a chance of skin erosion.
What about the genital bits? It's all over the penis.
Or I'll ask them to remove.
Yeah, me too.
I'll ask them to remove.
Yeah, it's not impossible to do Megaderm implantation at the same time. Thanks again to Dr. Koo for his time. If there's any question, please contact me. My email and contact information is below. Thank you for watching.
Thank you. Bye-bye.
Bye-bye.